Do you struggle writing your daily soap notes? Do you feel like you spend too much time on them because you don't know exactly what you need to put in your daily notes? Here are some tips for writing efficient and high quality daily soap notes. First of all, the S, which is the subjective section. In this section, you're going to report anything that was told to you by the patient or by the parent, the caregiver, maybe about how their week was, anything that's relevant to your therapy session. Maybe it's how they implemented what you recommended in your last session. Maybe it's successes they've had. Maybe it's challenges that they've had. That's what you're going to put in your subjective section. The second section is the objective section. That is exactly what it's supposed to be, is objective statements only. So technically anybody could write this section who saw your session. So it's exactly what happened. Maybe you're saying their accuracy, maybe a score, exactly what happened. Okay, in this section, we're not putting anything like they're making progress or they're doing better or any kinds of analysis. It's only the facts, exactly what happened in your session. The third section is the assessment. And this is the most important section of your note. This is when you're truly selling your service. You're selling your skilled service to whoever's reading it. And you are saying, this is why they need continued services, or this is maybe why we're going to reduce services. So this is where you take all the facts that you had in your subjective and your objective, and you analyze them and you use your skilled brain. So you show, okay, they're making progress based on the data. They're making progress in this area, or they're reaching this goal. Okay, so but they continue to still need that skilled level of service. So this is a very important section that you really sell yourself. You combine all that data to create this analysis of the importance of the therapy services. And the last section is your plan. Try to avoid just saying continue with services. That's not skilled. That's not really showing how we're going to modify our session next. So in this section, you're going to put, okay, next session, I'm going to level this task down. I'm going to level it up. I'm going to add a visual support. I provided the family with these activities to do next week. So really showing, once again, that skilled level of service of how you're going to change for next week, because you are. Because if you're doing the same things every week and not seeing much change, then that's not justifying our services. So in this section, really putting in there what is going to be different about next week. Okay, so this is in the plan.